The information provided on lifeinterruptedradio.com is for educational purposes only.
Welcome back, everyone, to the Autoimmune Hour on Life Interrupted Radio. I'm your host, Sharon Sayler from SharonSayler.com. I can't talk tonight for some reason, but anyway, we're here with Dr. Nasha Winters, and she's the CEO of Optimal Terrain, and she's an integrative medicine expert. She's just a walking encyclopedia on all things about patient care. But tonight we're talking about diet because there's a lot of confusion about diet and some things that I've read and seen these days. One of my questions I had was about this rest period of you should be able to go from the time, about 12 to 16 hours. One of the things that I read that I was a little surprised by, is it true or not true? Here's our fact or not fact, that women is more along the lines of the 12-hour and males are more along the line of the 16-hour, or is that some fact or not fact?
It's not black or white. It's not a fact or not fact altogether. There's variations to that because it depends on the output of energy from the individual. So you have men who are much less, it depends on a lot of factors. It depends on your output of energy. It depends on your stress level. That's a key. Okay. It depends on your hormonal balance. It depends on your sleep cycle. It depends on how much blue light you're exposed to. That's why I wear my little lenses when I'm on camera at certain times of the day. It depends on your epigenetics. It depends on a lot of factors that help determine what is the most appropriate timing of your meals, forms like base camp of your meals. So there really isn't a one size fits all. And when we talk about things like even ketogenic, there are times and places where we use it like a sword, like a scalpel, like an absolute therapeutic approach to deeply create a metabolic shift to have a desired outcome. And whenever people ask me about, well, can you be on a ketogenic all the time forever? You can absolutely thrive in that, but you don't need to. We never did ancestrally. Now, unless I'm working with you and I'm dealing with a very aggressive, such as brain tumors, most of my brain tumor patients will be on a ketogenic diet for the duration of their life. And hopefully it's a duration of a very long life because it is a very sensitive organ to metabolic instability, and ketones keep things very smooth in the system. If I have someone who has diabetes or obesity or like other issues, it can be a very powerful tool to push that back as well. But most of the time, most of us, if we just simply finish our last meal and get up in the morning and have our next meal at a nice delay, 12 to 16 hours, most of us will be that hybrid engine we were talking about before the break. And depending on all those other factors we wove in will determine how well that person will do. So a clue to me if somebody's metabolically inflexible is that they can't comfortably go more than 4 hours without a meal. If people tell me they get the hangries, they get shaky, they get confused, they get irritable, that tells me they're metabolically unstable. If they have any personal or family history of polycystic ovarian syndrome, obesity, cardiovascular disease, diabetes, prediabetes, pancreatitis, pancreatic cancer, that is also just a big red flag for metabolic instability. And so those are some people that would really do well to push back their carbohydrate intake drastically and to pull out and make their only carbs via their beautiful leafy green veggies. That's really the key there. And then the people who, kind of say, oh, keto is bad. Again, they're taking it in that it's a particular fad or diet. You have to remember, like I said, this has been a natural part of our physiology since the beginning of humankind, right? And then we actually started using a ketogenic diet therapeutically in the 1920s per Harvard for epilepsy. Still today, the best treatment for epilepsy. And that also has led to a lot of cool research around using it for any neurological disorder of any kind. And the fastest growing disease process in the Western world today is neurological disease. So that includes we're dismantling our brains. Why? Because we've been on a fat-free kick for decades.
Oh, that's one of my questions here on my list.
We're just fat heads. And the sheets that wrap around our nerves are 100% fat. And we've been putting ourselves on low-fat, fat-free diets for a long time. And what do we do to offset that? We kicked up the sugar. And so we've been frying our brains and our nerves for decades now, and then metabolically throwing us off. So most people will not be in ketosis if they go 12 to 16 hours of fasting. And so if that isn't enough, then you have to get them into a state of high fat, super low carbohydrate, and even low protein intake to push them back into being that dual engine again. And once they adapt, then they easily go back and forth as needed. It's a powerful way to take you back to a natural state where we've always been as human beings.
Well, this is awesome. That was fats is here on my question sheet, but which one of my questions around fats, though, is we're terrified of fats. What is it? I don't even know if this is appropriate words. What's a good fat and what's a bad fat now? I mean, I don't know anymore. I really don't. We've been taught eggs. We've been taught this. We've been taught that. I don't know.
Yeah. Well, let's keep it simple. You're right. We've all been very fat phobic for a very long time. But again, our nerves, our nervous system, our brain can't function without it. Our immune system is also dependent on fatty acid synthesis. We can't even overcome pain response without good fatty acid synthesis. And our cells are starving. We're really overfed and undernourished on the planet today. So when I think of a really good fat that's kind of across the board, seemingly safe for all populations, think olive oil, but real olive oil, because most of the stuff you buy in the grocery store is hexane, like pulled out of stuff, and it's like cut with canola and other cheap omega-6 high fat, fake, vegetable plant oils. Make sure it's 100% olive oil. That is super, super good for your membranes of your cells to function properly. That's a really good one. Another really good one, is the macadamia nut oils, the hazelnut oils. These are oils that are higher in the omega-3s versus the omega-6s of a lot of the other seeds and nuts. Still, seeds and nuts, they have omega-3s, but they still have quite a bit of omega-6. Avocado and avocado oil, fabulous oil. Coconut oil, those are also really key. I have my folks eat a bunch of olives, a lot of coconut, dried coconut flakes that are unsweetened. These are great snacks to have.
That was my next question, because you had said all about oils, but just eating an avocado or eating a hazelnut, same quality, same thing, except maybe we get a little fiber in there.
Exactly, a little fiber, but you're also getting a little carbohydrate in some of those. So you don't want to go too overboard on those. But yes, absolutely, get the whole plant, the whole organism, the whole creature into your body, And then the same thing when it comes to animal fats. So the eggs, we've gotten into this place where we're just doing, our egg whites. That's actually if you're just still doing egg white omelets and whatnot, you're actually getting a lot more oxidative damage that way. You need that, you need the fat in there to sort of soothe the inflammation that the pure albumin protein, which is in the white, you need that fat. The cholesterol is what's protective. Now, just a quick lesson to your listeners, cholesterol is the mother hormone. Out of cholesterol, we make our neurotransmitters and we make all of our sex hormones. So basically how you think and feel are based on fat. Okay, and we bastardized cholesterol as well. And so when we are scared of cholesterol, that's the last of our worries. And again, the research has come around full circle to say we should worry less about cholesterol and much more about inflammation and sugar intake. So that's key here. But when it comes to good fats, the other thing we've pulled out, ghee, butter. Okay, these are hugely powerful fats. And then again, where we got all of our fat before we went on our fat-free craze was from animal fat. So lard, tallow. Our parents and our grandparents and our great-grandparents, I remember the drippings, the little container, Folgers container under the sink that captured every little dripping. And then that was the base of everything you baked, everything you cooked, everything you fried was that oil, like kind of over and over again.
But I have to remember that my grandmother worked a lot more physical labor than I work.
Thank you. We all do. I mean, today
they could work that off.
And we're coming from that. So now we sit an average of 20 hours a day. As American, we're either sleeping or sitting during that. So we're down. And actually it's probably a bit more than that. We're also outside less than 15 minutes a day. So we are not living the lifestyle that our parents, grandparents, great-grandparents, and so on were living. All of these factors come in. So when people get really weird and dogmatic and militant about which is the right diet, it's so much more than that. There's even researchers out there who say that it's not even so much about what you eat, although it does matter. I promise you that. It's even when you eat. So if you're eating really late at night when your body should be in the healing, processing, repair mode, and you're trying to digest at that time, that is going to cause some harm to your microbiome and to how you digest those nutrients. So it's much more complex than this diet good, this diet bad. Ultimately, if you stick with real food, plant-based, and if you're going to have animal protein, you've got to make sure it is spotless, super clean. And what you and I were talking about before the show started is, first of all, a ketogenic diet, the myth around that is that it's a high protein diet. In fact, it's not. It's in fact a low protein diet. And so it's a high fat diet. So the protein in our country today in the West tends to be a lot of protein, and you don't have to have that much protein to rebuild the tissues. So this shouldn't be a meat-based diet for anybody.
And when we're saying, like, I think people get confused on what is a lot of protein and what isn't a lot of meat protein. I mean, we've got things like, you go into a restaurant and there's ounces and ounces and ounces of meat proteins offered to you. What is a standard serving that you suggest is appropriate in a meat protein? If you're going to go with animal protein, what's a standard serving?
Sure. So just, a kind of a good general sense is if you're not an uber hardcore athlete, you really don't need more than probably 0.8 grams of protein per kilogram. Okay. So that's a little math that your folks will have to do here, but of lean body mass. Okay. So that's what we're leading to and specifically to lean body mass. So to simplify this, most women, let's say an average of 150 pounds, are likely getting about 50 grams of protein a day. Men maybe upwards of 7, depending on their weight. So kind of to give that guesstimation. So just to get a sense of that, like a serving, a few ounces or a few grams of meat would be about the size of a deck of cards. Okay.
Oh, okay.
So that's not, when you think about a really good serving of whether that's fish, which by the way, the omega-3s in fish, there's nothing better in anchovies, sardines, good quality Alaskan salmon, things like that, are super high quality fats as well that we're all very deficient in. So even, a smaller piece of salmon or a little piece of grass-fed, wild, free range chicken breast, or, I'm just trying to give people ideas that even when I say meat, I'm putting into that fish, chicken, turkey, poultry, eggs, dairy. I'm just kind of lumping it all together. Animal protein, I guess, for simplicity. And even for folks, like I work with a lot of folks who are kind of more vegetarian, going kind of a low carb or keto diet, or even pulsing of a keto diet or intermittent fasting, low carbohydrate diet. We can do this very well if you can bring eggs on board and butter on board. You can do a lot with that to get your protein needs and your fat needs met. And then of course, all those fats we talked about are easy to access no matter if you are a meat eater or an omnivore or a vegetarian or a vegan. Those fats are all kind of user-friendly across the board.
Awesome. We need to take one more quick commercial break. And I love the fact I love butter. I grew up on butter. I can go have some butter. Whoa! I'm so excited.
Peanut butter. Yep.
Yeah. So anyway, we'll be right back after this quick commercial break, and I'll get more excited here in just a second about more butter. Wow. Okay, we'll be right back.
The information provided on lifeinterruptedradio.com is for educational purposes only. What you hear, read, and see on Life Interrupted Radio is based on experience only. The information presented here should never be used for any legal, diagnostic, or treatment purposes. Always seek sound legal, medical, and/or professional advice regarding any problems, conditions, and any of the recommendations you see, hear, or read here on Life Interrupted Radio. You've been listening to Life Interrupted Radio. To learn more, listen to other shows, and gain free resources that can help empower your life, be sure to stop by lifeinterruptedradio.com.